Good evening. My name is Jim Acabellis. I'm the Senior Vice President of Government and Regulatory Affairs at the Connecticut Hospital Association. And I'm pleased to be here to testify in strong support of House Bill 5241, an act establishing a Bureau coordinating services for the deaf, blind, and hard of hearing. For a number of years, CHA has been working closely with the deaf, blind, and hard of hearing community to troubleshoot issues and to work on issues that are across all hospitals. And we enjoy that partnership because every patient that we can ensure has effective communication has significantly better care. So we are pleased to do that. One of the issues that we've heard repeatedly in our conversations is the lack of coordination of services across the state. We tried something a couple of years ago to have similar websites and web information put on all state agencies, but this is a significantly better solution, to have a bureau within the Department of Aging and Disability Services to coordinate services, and we strongly support it. We would ask for one change or addition in the legislation. Section 2 creates a working group to look at access for health care for individuals that are deaf, blind, and hard of hearing. CHA is part of that, and we thank you for that. But we believe adding a representative of an interpreting agency that does healthcare interpreting would be a great addition to this group. We all know that we have a workforce shortage across the country and in Connecticut on almost all professions, but particularly in healthcare and with interpreters. So to have them part of the conversation, we think will be helpful going forward. Now I'm going to do something that I really always tell myself not to do, and make two comments on a piece of legislation that I was hearing about today. And it's Senate Bill 314, an act concerning emergency Medicaid coverage for treatment of emergency medical conditions. CHA and Connecticut hospitals have long time support of expanding coverage. We know that when individuals have coverage, they seek care, and they seek preventative care, and they don't use the hospital in situations where they can get care in a different setting, the right care at the right time. This bill, as another bill related to Medicaid coverage for diapers that you heard my colleagues talk about, are a theme, and we are very pleased that the Human Services Committee is looking at the Medicaid program in more creative ways than we have in the past. And my understanding is this legislation will look at what the other states surrounding us have done and to try to model our Medicaid emergency coverage after that. And we support that and strongly support 5241.
Thank you very much. I had a question, but I'm going to ask my ranking senator if she has any questions. No? Okay, great. Thank you so much for your testimony. I think, I know this is something that we have tried very hard as a legislature to address, how we can help those who are deaf of hard of hearing in a medical setting. I know we've put some ARPA dollars towards this in the past to look at this accessibility issues. And we also made some changes to interpreter qualification laws in the medical setting. It seems like to me we have a workforce issue, and that's probably one of the areas why so many folks, like the folks that came in today and talked about some of their issues that they have received in hospitals, was due to a lack of interpreters. As the Connecticut Hospital Association, what do you advise we can do as a legislature to address that workforce issue so that we can ensure that these interpreters are available? Do other states do anything like this to encourage it? I know the Governor's Office of Workforce Strategy is looking very much at the healthcare space, but do we need to maybe, as part of that working group, look at how we can address some of those workforce issues? So if you could talk about that for a minute, I'd appreciate it. Thank you.
Yeah. It is a significant problem, and it's increased since COVID, where interpreters for a long time did interpreting from their homes. And since there's a shortage, you can fill up your entire day interpreting at home, as opposed to having a call to drive to a hospital, to drive to a medical setting and come back, right? So that's changed, lifestyles, and it has impacted interpreters as well. I believe we have one school in Connecticut that does certification for interpreters. I think we need to keep that in the front of our minds and maybe look to expand that. Because it's sort of like the conversation we have around nurses is sometimes we don't have enough of the education slots for people that want it. And we have to keep interpreters sort of in the forefront of our minds, because, we talk a lot, and we do as well. And this is sort of a constant reminder that we talk about a nursing shortage and a respiratory therapist shortage and a physician shortage. We need to keep interpreters in the front of mind, and I think work with our higher education system to see if we can expand a program, maybe for a 2-year time frame, to see if we can. I believe it's Nantucket, or I don't think it's Northwest, is the and maybe at a different part of the state, and try it for 2 years as a pilot program. And if we have enough people coming in, then work to make it permanent. But we need to build it so people will come. And I think that's one of the things as a legislature that would be extraordinarily helpful.
Are you familiar with other states that do focus in on the interpreter pipeline of healthcare folks?
I have had some, I can't tell you I've had extensive conversation with my colleagues in other states, but more along the lines of, yes, we have that issue as well. I haven't done the deep dive on whether they have more than one school or more, or how they have dealt with it. But it's a good challenge to go out and to see if there are other ways in which to do it.
Thank you. Clearly, we heard today far too many stories of folks that suffered as a lack of interpreters, and we need to address that as a state. And I appreciate that you're willing to be part of the solution there.
We know that having good health encompasses a lot of different things, and being able to communicate with your provider is a key part of that. Whether it is language or whether it's American Sign Language, but how you communicate is how you can work with your provider and get the best care you need, and get the best treatment, and get better, and get preventative care services in physicians' offices.
Absolutely, absolutely. So thank you so much.